Hello, and welcome to the Ripple Effect podcast. I am your host, Lyndsi McNally. Your co host is Champ Jones, and our special guest is Miss Amy Marston.
Hi,
Hi, thanks for coming.
thanks for having me.
I know last week I tried to get you, and it was a short notice.
I had to have makeup on.
Yeah. Well, it's probably a good thing. I had to have questions prepared.
Well, true.
So, you know.
Your questions were very good.
Thank you. Well, you can thank Gemini because she and I are best friends. Before we get into, public health and stuff like that, what have you been up to?
Playing with a grandbaby.
2 new knees.
2 new knees and a 2-year-old grandbaby. So 2 is my number. Oh, I did win the Calcutta on Saturday at the Sportsman's Club and won $1,300 on a horse that I bid $100 on.
The Kentucky Derby.
Love the Derby. I had been researching for at least a week and a half, and the only reason I bid on her was because the one I wanted went for over $200, and I wasn't paying that much for a horse. So when it came to him, and the trainer being a female, I was gonna get him, come hell or high water.
And that was the first female trainer in the history of ever to win the Kentucky Derby.
Yes, ma'am.
Pretty cool.
Yes, ma'am.
Yeah, cool. It is pretty cool.
But otherwise, not much. Enjoying the grandbaby, having fun with him.
Yeah, he's a cutie pie.
He said his first cuss word last week.
Oh, precious.
They're lucky it wasn't the one that they say all the time. So his toys got caught together, and he couldn't get them apart, and he threw them and said S. Jordan's like, well, at least he's using the correct context. I said, okay.
Yeah, that is right. He's pretty smart.
Yeah, he is.
So I have my notes here with some questions, but first, you have been an employee at Three Rivers District Health Department for
a total,
all the times you've come and gone.
Do
you need a piece of paper?
18 years.
Wow, 18 years. So you started what year did you start?
1997, I think, was when I first started.
97. So Doodle was not born.
She doesn't count.
No.
She's just a baby.
Her is.
I did 5 years of 5 years of clerk for home health. And then I went to the clinic with your mom, Miss Patty Green, and worked there while I worked full time, did nursing school full time.
That's what I was going to ask. So, forgive me, I'm a mouth breather today.
Okay.
I have something going on. But your pathway started a lot different than a lot of people, because a lot of people get out of school, they're like, I'm going to go do this, and they go get the degree, and then they go into that field and they stay there for 50 years. You didn't do that. Now, did you have a vision of being a nurse when you were younger? Okay. But you started as a clerk.
Here's what's funny. I turned 30 in November, got divorced in December, and started nursing school in January. Wow. That was a couple, 3 months there that was,
well,
yeah,
before midlife. But it was not a crisis, though. It was a breakthrough.
Yes.
And it was like you kind of, you had to. Mm-hmm. You had to do something to make more money.
Because I was bringing home $600 every 2 weeks.
That should be a crime.
Bringing home, but then,
but still working in the public health department.
Mm-hmm.
And so wow, so yeah, you started off different. You went into nursing. What type of nursing did you do?
I wanted to be an OB nurse. That's why I went to nursing school, and I had made up my mind that I wanted to deliver babies. Mm-hmm. And I got about halfway through nursing school, and I had a professor. His first name was Brian, and he was passionate about cardiac. I became extremely passionate about cardiac. And to this day, if it wasn't for 2 bad knees and old age, and I would still be a cardiac nurse, because I love just the functionality of the heart. Don't get me wrong, public health is my calling, and I know that. But I loved cardiac nursing. Loved it.
So fast forward into what you do now, it's has everything to do with cardiac.
Hmm.
So you are a specialty nurse, but what's your title or job, your description here at Three
So my
Rivers?
title is a specialty nurse consultant. I work in chronic disease. I've done some education on alpha gal. I've done education on prediabetes. I focus mainly on prediabetes and diabetes, um, and trying to work with the public and individuals to either improve their diabetes situation, or because you can actually get diabetes in remission. You can't cure it once you have
Type
that
1?
diabetes diagnosis. 1 and 2 can go into remission.
Didn't know
1's a
that.
little harder
Mhm.
because type 1, you're pretty much required to take insulin from day 1.
Mm.
But with all of the new things in and around, and automatic infusion devices and CGMs, which are continuous glucose monitors and things like that, with all of those going on, you can get diabetes very well controlled, which is what the remission is.
And you attribute that to technology?
Technology for sure.
Wow. I did not know that. I
Yeah.
learned that just now.
Um, I feel like continuous glucose monitors are going to be what helps the most people, because I've come across people and I talk to people that don't want to poke themselves 4, 5, 6, 7 times a day, even though I've got different methods that can help them, you know, poke on the side of the finger or whatever. It's not as bad. And I'll be honest with you, if somebody told me I had to do that every day, I would not want to do it. I would rather you draw blood out of my arm than to
Mhm.
poke my fingers because they hurt so bad. With continuous glucose monitors, you poke yourself once every 10 to 15 days, depending on the machine that you have, and it feeds it to your phone. You can look at it at 2 o'clock in the morning, you can look at it at 5 o'clock in the afternoon, and you can see, based on where the arrow is pointing, which direction your blood sugar is trending.
Wow.
Yeah,
And
it's
that's
they're
in real
phenomenal.
time.
Yeah, no,
And
with that, it's like a 5-minute lapse because it's in
okay.
the interstitial space as opposed to the
Okay.
fatty area, basically, as opposed to in your bloodstream, which is what the finger stick is.
But the finger stick is whenever you stick your finger.
Correct.
And so you might be fine right now, but in 20 minutes you might not be fine. You don't
Correct.
even know it until you're passed out on the floor.
And the CGM will tell you what you're doing and where you're going.
So yeah, I could go on all day about the technology of that. I have a friend who has one, and his alert is connected to his wife's phone.
Oh, cool.
And I've been with her before, and she's called him. Hey, what are you doing? He'll say, "Is my blood sugar whatever, high, low, whatever it is?" She's like, "Yeah, and he had no idea. He didn't feel it. So thank God he had that because he could fix that before it turned into a symptom. Because by the time you have a symptom, let's say that I have type 1 diabetes, by the time I'm starting to feel whatever, it's going to take that much more effort to get me back, as if I had that
Yes.
continuous feed, and I could have just adjusted my medicine and
Well, not just your medicine, you could have eaten something.
mm,
So
mm.
you could have had like a glucose tablet. There's a rule of 15, especially when you're in hypoglycemic. You check if your blood sugar is below 70, you eat 15 grams of carbs, you wait 15 minutes, and then if it's trending up or doing better, then you don't have to do anything. But if it's still dropping, you eat another 15 grams of carbs, and then you wait 15 minutes. The thing is those carbs that you eat in that process is a Coke, an orange juice, or something like that. And then once you start trending up, you want to get some kind of substance in your body because that's what's happened. You've gone too long without getting any sugar in your body.
So it's okay to shoot the sugar up really fast with by whatever means necessary, but once it gets there, you need to maybe eat some complex carbs.
Yes.
So you could eat a candy bar, but after that, you might want to eat like a grilled chicken sandwich
Yes.
on whole wheat or whole
Correct.
grain bread or something like
Yep.
that. Okay. That is really interesting. So I have a few questions here.
Okay.
As a specialty nurse within a district health department, how does your approach to diabetes management differ from a traditional clinical, and the question was or hospital setting, but for you, a clinical or a home health setting? How is it different? how is what you do as a specialty nurse and then maybe in the diabetic field or any field or any focus different than what you did in the clinic or at home health?
I actually have the time to spend with them and I focus on what their concerns are. My headphones are sliding
Oh,
off, sorry. I can spend more time with them, but I
mhm.
can also focus on what their concerns are. The first thing I ask them when they sit down is, what would you like to learn from this session?
Mm,
And the reason for that is there are so many things that I can talk about and go over and review with them. And there's a lot of information to give in that time frame. I want them to remember what they want to know, what they need to know. I've had people come in and go, I know this is bad for me and that's bad for me. And I will look at them and say, there is nothing that's bad for you.
mm.
There are some things that I would recommend you not eat daily, like fried potatoes or things like that. But you're never going to hear me say that something is bad for you.
Other than drugs, you're gonna
Well,
tell them
true,
that. Okay.
true, yes,
Okay, just
but
wanna make sure.
that's not on the diabetes or diabetic diet. So
Oh, okay, we're good. Phew, thank God. Um, what if they don't know what they wanna get out of that session?
then I tell them that I'm going to go over some broad things, and if they have any questions or if any subject that they want to learn more about, we can dive deeper into that. So the way that a normal session works with me is they come in, I have them fill out this short questionnaire, and diabetes is not just blood sugars and what it does. Diabetes affects you from your head to your toes. It affects your limbs. It affects your heart. It affects every organ that you have, and you have to be careful with that. And there are a lot of people that don't understand the long term effects that that can have on them. Um, so I bring them in, they answer the short questions if they've seen an eye doctor. If they don't know what they want when they come in, I like for them to come back a week later. And
Mm,
in that week, I have them write down everything they eat and drink and their blood sugars, and if they're on insulin, how much insulin they take.
mm,
And the reason I do that is because I like to compare the foods that they're eating with what their blood sugars are doing. And then we can talk about, okay, so see, you ate fried potatoes 3 days last week. Look what it did to your blood sugar the next morning. I had a gentleman that I saw just last week that we talked about, and he said, I ate snacks last night. And he said, I couldn't stop eating snacks. And he's like, and I know that's bad. I,
mm.
I could not get him to stop
Smack
using the
him in the
bad
mouth.
word. And I'm like, they're not bad. It's not bad. You can have those
If you
snacks.
needed a snack, you needed a snack.
But he's like, well, what do you recommend I have? And I'm like, do you like cauliflower? Do you like broccoli? And he's like, yeah, I like all of those. And I'm like, have those instead of the candy bar that you ate last night or whatever. And so we do that comparison. And after we do that comparison, I'm like, what do you want to learn from what we've done? And when I tell them that, I always, because I know that a lot of times they'll say, I want you to write down everything you eat and drink and all of your
Mm,
blood sugars and all of this stuff. And it's a lot. It's overwhelming. Sticking your finger. Um, Writing everything down, remembering all of that is so very overwhelming for them. And so I ask them to do it. And I tell them in the beginning, I want you to do it for 1 week because I want you to see what affects your blood sugar. And everybody is different. You know, I could eat peas today. I am not diabetic, but I could eat peas today and it could raise my blood sugar, something awful. You could eat peas today and you be a diabetic and it barely affect yours. So I like for people to know the effect that the foods that they eat are going to have on their blood sugar. And a lot of people don't understand you still need carbs.
mm.
Your body uses those carbohydrates for energy and you need those carbs. And a lot of people are like, I don't need any carbs at all anymore. And I'm like,
Right. Yeah.
but are you tired all the time?
Yeah. Are you
So,
happy?
yeah.
Are you pissed off?
Yeah,
Because I
exactly.
would be.
Yeah. So that's what it's different is that I can talk to them one on one and I can let them ask questions and I give them my phone number. And I
Mm,
say, if you have any questions, please reach out to me because I don't
mm.
mind it. And if I don't know the answer, I'm going to find the answer for you.
That
And you
means a
don't get
lot.
that when you're in the hospital or.
That well, so that means a lot to somebody when you trust they what is it? They've been trusted with your personal cell phone
Mhm.
number. Like that's huge.
And unfortunately, not a single one of them has called me yet, but that's okay. They've got it if
You'll
they need
build a
it.
rapport with them though, and they will.
And I do like to see them, especially if they're a new diabetic and it's so much that I have to provide them because
Mm,
I want them initially to know what do you do if you're having a day where you're having vomiting and diarrhea because you've got the flu. What do you do on those sick days? How do
mm,
you take care of yourself when you still need to take food in? to
Mm.
keep you from either being too low, too high, or whatever your body does.
Oh, wow. I didn't think about that.
Mhm. And then I give them hypoglycemic, hyperglycemic, making sure they take their medicines. I mean, there's a whole.
And that's so much information. Excuse me. Do you hand them like papers or is it electronic or is it a little bit of both?
Most of what I give them is hand. It's books that are provided through the state. It's things that I've printed
Oh,
off and found. A lot of people don't understand what their A1C means,
yeah.
and so I have found this really cool infographic that shows if you're consistently at this blood sugar, say like it's 180 or 190, then your A1C is going to be this number.
Oh.
Because a lot of people are like, my A1C is 10, but I don't understand why.
Uh-huh.
And so then I can show them this is what the equivalent is. This is where we want you. Because if you've been diagnosed with diabetes, under 7 is what they really would like for you to have. But I like the 6.5 because that higher blood sugar is going to affect all of your other organs.
Yeah. That is a big part of the diabetic program that I think is interesting is how you get to teach people how it's affecting every other part of their body where in a clinical setting they're just like, "Oh, just do this because it's not good." They will say it's bad for you. Don't do
Mhm.
that. You leave, you're like, "Oh my god,
I
I can
can never
never
eat
have anything."
anything or
Yeah, and you feel defeated, and then people forego going back to the doctor because they're like, "I haven't been doing what I'm supposed to, so I'm just
I'm
not."
just going to avoid them.
Yeah, I'm gonna be sick. I'm gonna lose my feet.
I
So,
had an so she wasn't diagnosed with diabetes, type 2 diabetes. She was diagnosed with impaired fasting glucose.
what impaired?
Impaired fasting glucose, which made sense for
Oh,
her physician because she had never had an A1C that was elevated. She wasn't there because she felt bad or was having any of the symptoms of diabetes. She was there for her annual exam. And at her annual exam, they test her A1C. Her A1C was just a smidgen over 6. Well, over 6 is considered to be diabetes. But with her, I think it's phenomenal. They diagnosed her with impaired fasting glucose, and in 3 months, they're going to recheck it. So she came to see me. They put her on the metformin. They put her on, I think it was Ozempic they put her on, but it could have been Mounjaro. I can't remember right offhand. But they gave her the tools to bring her A1C down.
mhm.
She came to me willingly because she wanted to know what to do, but they gave her a blood glucose machine to check her finger sticks with no education.
Oh,
She went and picked it up at the pharmacy. No education was provided there. So she called me and she's like, I know her. So she was able to reach out to me. She's like, can you help me with this? And I'm like, I sure can. And we met, I think we met 2 weeks in a row, maybe 3 weeks in a row for an hour and just went over what she could eat, what she should eat, what she shouldn't be doing. Um, she was a particularly harder case just by other circumstances in her life, but she had no education on how to do a finger stick. And I've had that happen twice now.
oh,
One came to me, still had it in the box. She's like, I don't know how to use
oh
this. I
no.
don't know what to do with this, and I don't know
And
how to
even
use
at the
it.
pharmacy, when you pick it up, it says, "Were you counseled today?" And a lot of times, not my pharmacy, but other pharmacies I've been to, I've seen them just click it for the
Yes.
person, like, no.
Yeah.
Now, if I have a question, I'm gonna ask,
But not everybody will
but
do that,
most
and
people don't.
some don't know what to ask.
No, and they feel dumb. So I don't blame them for not asking because it's like shouldn't I already know this? No, you shouldn't.
Mm-mm.
You shouldn't know
Not if you're
anything.
newly diagnosed, and both of the girls that met with me were both newly diagnosed diabetics.
Wow. So, okay, I could go into that for
I
a
know.
long time too. Um, Here's the next question. From a community health perspective, mind you, this is the first time I've ever read this question. What are the most significant oh yeah, this is a good one. Let me start over. From a community health perspective, community health, what are the most significant barriers patients currently face in managing their diabetes? And what do you do to help bridge those gaps? So we already touched on that a little, but what the barriers would you say are the lack of education from the medical professionals, the doctor, the pharmacist?
And don't get me wrong, most physicians are given a quota. you have to see this many people a
Oh.
day.
Oh, yeah.
You have to see this many people a week. So the fact that I can supplement that for them and I can do it on a laid back basis as opposed to you have type 2 diabetes. We've just diagnosed you and here's what we're going to teach you.
Yeah.
They've got a day or two to think about it. Triad is exceptional for sending me referrals. I mean, they keep me hopping. Some weeks I get 3 or 4 referrals, but I get at least 1 or 2 a week.
Wow.
Um,
And their pharmacy. I love the girls in the
well, that's
pharmacy over there.
that's what I hear.
Yeah.
I don't get referrals from them, but I get referrals
Yeah.
from the
Yeah.
doctors.
Love you, Shelby.
The things that I think are most important for that I provide are the importance of being physically active.
Yeah.
Most people don't know that. Whether you're diabetic or not, being physically active is very important. Kaylee Fitzgerald is my PTA that I work with at Ziggy's, and she
Oh,
says
love her.
motion is lotion. So the more you move, the better your joints work. And so she's like, hey, just keep moving. And I've noticed if I sit for too long, I get up and I feel like I've been beat at the knees. But if I get up and move religiously around, I've that each day gets a little better.
Yeah.
People say, how are your knees doing? Each day gets a little better.
Yeah.
I mean, today I'm walking somewhat normal. So
I'm gonna have to tell my dad that motion is lotion.
motion is lotion. Understanding that being active is very important, and it helps regulate their blood sugars because their body is using that insulin to fuel themselves along with those carbohydrates and stuff. So it helps with the absorption of the insulin.
It's funny you said that. I was with somebody who has type 1 diabetes. We were in Louisville for an event and we'd had some cocktails and she had bourbon with Coke. And she had like 3 of them. You know who you are. And we were walking.
Don't let her manhandle you.
No. But if you ever go to any city with me, you know that I'm in control of the itinerary and it is full. The schedule was full. So we would go from here to here to here and we were walking, 90 miles an hour. And she checked her blood sugar. She's like, I cannot believe that it's whatever. It was perfect. She's like, it's all this walking we've been doing. Otherwise, definitely. I would be sick as a dog. She said, I'd probably be throwing up right now. So I learned a little bit about it from her.
And in everyday life, that's being and it increases your mood. It makes, I mean, it just, at one time I got up at 5 o'clock every morning for over a year and went to the gym and worked out. And I am not lying. My days were so, I mean,
your mental health.
Yeah. People think, oh, it's crazy you getting up that early. No, now mind you, I was in bed by 8:39 because I was still also getting so many hours of sleep. Which is 8, by the way, that is recommended for everybody. But anyway.
What if it's 14 for me?
Well, I'm with you. I like that. Yeah. The more I can sleep, the better. Sleep. Me too.
10 hours, anything less, I'm Roseanne.
Yeah. I like to sleep.
I mean, I love it.
But it helps diabetics and non-diabetics. Medication management is really big. And making sure that they're not missing those medications.
And you do that with them too.
Yes.
You sit down and say, let me see the medicine they gave you.
Yes.
Have you ever looked at a medicine and been like, or are you allowed to do that?
I'm not sure what I'm allowed and not allowed to do yet. I haven't really sat
Better
down
to ask
with
for
them.
forgiveness than for permission. It's okay. This is a new program. We can just say that.
But I do have some things that I've learned along the way that I would love to sit down with providers and say, hey, let's look at this. Medication management, being active, understanding and checking their blood sugars because you can't treat what you don't know. So if they don't know how low it is, that's where the continuous glucose monitors are phenomenal. And then
are those expensive?
You can buy them over the counter for like $80.
So
now here's the thing: a lot of the continuous glucose monitors, you can buy them on Amazon, by the way.
So I could tack one on.
You could. You could.
Really
you could.
Is it those things that I see on people's arms?
Like right here. Yeah, that's like this big.
Yes.
Yeah, that's what that is. It's a continuous glucose
So
monitor.
there are non-diabetic people who wear them around.
Oh, yes. Because they want to know.
Yes. Whatnots.
They want to know what physical activity does to their blood sugars. And because those are the people who are very in tune to their bodies. because most people who don't have diabetes don't pay attention to what their blood sugars are.
Until they get a headache and they're like, what's wrong with me? And then,
but those who are very in tune to their bodies, mainly heavy athletes or people that are just aware of their body, will use them too.
I wish it wasn't called diabetes education, because instantly you're in a box.
Mm-hmm.
It should just be health education. Am I going somewhere with this? I feel like we're starting a whole new thing.
Well, and I wish those that were in that pre-diabetes range of the of an A1C of 5.4 to 5.9 were referred to me more often as well, because I can prevent. If you're in that pre-diabetes, I can prevent and reverse, and type 2 diabetes is never brought into the realm of thought with you.
It gives me cold chills.
Yeah.
That's wild. And all it is a phone call and
a piece of paper filled out and faxed to me.
Yeah. Another question.
Or call me. I'll meet him.
Apparently her phone. We're gonna flash her phone number. Call now. If you call the next 5 minutes,
you get free education.
Yes. If you call the next 5 years, you get free education.
Yeah.
Can you share a specific initiative or moment in your work where you have seen the ripple effect of public health education, how it truly changes a patient's long-term health outcome? I know that's a mouthful, but
it's mostly surrounded about the conversations I have when people say, I know that's bad for me. I know I can't have that. I know that's taboo, or however they word it. And I look at them and say, I'm never going to tell you you can't have anything or that anything is bad for you. So the things that they love are no longer, oh, I can't have that anymore. So life is.
Do you see like a little light bulb go off on the?
I see a lot of smiles. A man last week I met with, I don't even remember what it was, but he's like, I know that's bad. And I said, I'm not going to tell you it's bad. It's not bad. And he's like, so I can have popcorn? I'm like, there are carbs in popcorn, but look at what the carbs in popcorn compared to other things that you could be eating for your snack at nighttime. And he's like, so I don't have to give up my popcorn. I'm like, no. Now you may just want to eat a cup of it as opposed to the whole bag. But it doesn't mean you can't have it at all. And he was like, that is great news. Because he came in there thinking she's going to say, you can't have this, you can't have that, you can't have this.
Slap on the wrist.
Yes. And I never do that. I never tell anybody you can't have anything. If you want to have that, you have it in moderation. And that's another thing, is for people who don't realize that a serving size and a portion size are two completely different things. So when you go to serve yourself at the family Thanksgiving dinner and you plop 2 big things of mashed potatoes on your plate and say, oh, that's my serving size. No, that's your portion size. That's what you choose for yourself. A serving size is what's recommended. And when you read that nutrition label, it will tell you your serving size is recommended to be
half a cup,
a cup,
so
or whatever.
A portion is what you divvy out.
Yep.
And a serving size is what the experts say, hey, dummy,
this is what you should have. Yep.
Wow, I just learned that for the first time.
And there are some things that you will be shocked when you see a serving size as opposed to what you eat.
Well, some of it's for the good, though.
Yes.
Like green beans, you're like, you can have a whole pan full of that. Not can, but you.
But you can, and it's like 6 carbs.
Yeah, and they're delicious. I was going to ask something else to do with that. Do you give people? Do you help them create a menu? Or is it something you've gotten into yet? Or
I can.
Do you say Mediterranean diet, or what do you?
I don't recommend any kind of diet.
Okay, good. Love that.
Because they are going to have to live with this for the rest of their life, and they need to understand that I'm never going to say you can't have that piece of cake on Mother's Day.
Yeah.
You just need to count that piece of cake on Mother's Day and understand that it's going to affect your blood sugar. Is it worth what it does to your blood sugar? Because if it spikes you up to 400, is it worth that piece of cake? Some of them are. It's just like if you're trying to eat healthier and you're not diabetic, is that processed Little Debbie cake going to be as good as Mama's homemade chocolate cake or whatever? And sometimes you can eat a couple of bites and that's all you need. And
it's a mindset fix, just like anything else. It's a habit. It's a habit that if you're diabetic or not diabetic, I'm not diabetic. And I have learned really hard new habits in the last 2 years with my eating. I've had to use tools to help me lose weight, but also to help teach me stop eating, you're full, and is it worth it? You know how full you're going to get. So you want to fill up on the chips, or do you want to wait and cook something that's going to be delicious and eat that and still going to get full? So
It takes 2 weeks
it's,
to break a habit.
wow, that's not that
Consistently
long.
doing something for 2 weeks. Do it every day for 2 weeks to break a habit, and then it becomes a new habit.
Oh, wow. So heard that. One last question.
Okay.
Oh, this is a good one. Looking ahead 5 to 10 years, what shifts in public health strategies do you believe will be the most vital for reducing the prevalence of diabetes? Next 5 years, innovations or shifts in public health. What strategies? And not just that you implement, but is there anything on the horizon with diabetes and diabetic care that you think, wow, that's going to change a lot of things? Maybe there's legislation, maybe there's insurance changes. I don't know what's on coming up,
I
but
think there are two things that are going to make a huge difference. I think the fact that very few insurance companies will cover the GLP ones, or they're covering partial to where it's going to cost you $300 a month to get those medications. Those have made a difference in people's lives.
for the worse.
Those those medicines have helped people's
No,
lives.
the fact they can't afford them now
Agree.
make
Agree.
change it for the
You
worse.
have to be diagnosed with type 2 diabetes or type 1 diabetes to qualify for most insurance plans. And when I say most, I say profit, government, big insurance or big companies are they're losing money by paying for those, but the long-term ripple effect will be beneficial to those people and to those organizations when their people are healthier. Thing is a fairly new thing that is coming out, and we're just learning about, and that's the rural health transformation funding that's been given to the state. One of the pillars of that is chronic disease, focusing heavily on diabetes and reducing the incidence and the results of diabetes. And I think that's going to be huge
Yeah.
because we want to reduce the people have diabetes. We want to reduce the effects, the long-term effects of diabetes. And I think that funding is going to be very important in helping us reach those goals.
Do you know how that funding works? Like it starts up here and comes all the way down, and let's say it's in our it's in the specialty nurse pool of money for you to utilize.
See, we're so early in the stages that we haven't even gotten down that
You don't
far.
even know
It's
what it would be. Okay.
correct.
We don't
Correct.
even know if it would come.
I think it will come down this far. It's just that funding, and it's make it taking a different approach to diabetes
Okay.
education as opposed to the ones we've been taking approaches to. The federal cuts in funding have drastically affected diabetes, and so this might actually be a good
Alleviate
way
some of
to
that.
yes, it'll help cushion that, but it'll also help us maybe take new approaches to diabetes.
Let's hope that bureaucracy doesn't eat all that up before it gets here.
Agree.
Because it's called rural health transformation, not whoever it would go to. Help us.
And three
Help
of our
me, I'm
counties
poor.
3 of our counties are 100% rural.
100% rural.
100% rural. So
well, that's interesting. This has been enlightening. Did you have any other? You have notes here.
I do. I've been looking at them.
Well, oh, yep. Well, my husband says that all the time. Well. All right. Yeah, you did it and I did it. All right. Well, this has been great. I've learned a lot.
Good. I hope everybody else does too.
And if you have one thing to say to future generations of people in your position, or maybe another health department that might be interested in doing, because are there other people like you in
There are.
Kentucky?
There are quite a few that have been paving the way long before me. That they do, most of them do the classes, where I'm probably one of the first ones to do the one-on-ones, and I prefer that way because you get into, even though you've got like people in the same room, I think people are more open to asking certain questions in a one-on-one as opposed to in a group, because people just don't want to sound like they don't know what they're talking about. So
yeah,
and I sound that way all the time, so I don't.
You're believable to me. Like you said in the beginning, though, I don't want to say diabetic. Every person with diabetes is different.
Correct.
A person with diabetes, I'm assuming peas elevate your blood sugar.
Well, they're a starchy vegetable.
Okay. Stupid.
Peas, corn, potatoes, the ones that we were raised on.
Me without diabetes eats peas, blood sugar goes up, or
probably not as much.
Doesn't do anything.
Well, it's a carb, so it's still going to raise you a little bit.
This person with diabetes, it raises it the same level as mine, but this next person with diabetes, it shoots out the roof. It's not one size fits all.
Correct.
So you can't just search something up on the internet and be like, I have diabetes, what should I eat? And it's whatever it spits out, it's going to tell you, and you eat it and you're still sick and you're wondering why. You need to see somebody who can curate that plan for you.
So that's why I have them do that 1 week of writing everything they eat down, and then their blood sugars when they take them.
Do people ever come up with, I've eaten salads all week long, I don't know what's wrong? Oh, I've been in the pool hall.
But there are some that I've had to meet with a couple more than once and go, hey, you ate chicken and dumplings, meatloaf, green beans, which was good, but then you also had corn and mashed potatoes and macaroni and cheese at the same meal with the chicken and dumplings.
Were you at my family reunion? Wait a second. Was it family night at church?
they did it 3 nights in 1 week. So it wasn't just a family reunion or whatever. So
yeah.
So that's where
maybe
I
all of those sides throughout the week, not at one time.
No, it was written on 1 week.
No, I'm saying maybe.
Maybe there you
switch it because up. I was going to say everything you said is like Southern fried country, like home style cooking. So, but you can do it in a healthier way. So.
Yes.
All right.
And look at your portion versus your serving.
My mind is blown.
And a lot of times in the beginning, you have to measure. You have to use a half cup or a cup or whatever and figure it out, because 1 scoop of your mashed potatoes doesn't automatically give you a cup or a half a cup or whatever. So
and what's in the mashed potatoes too?
Exactly.
You
butter,
got
milk,
heavy cream. Yep.
And then you have my sister who also has alpha-gal.
This has been great. I hope that you all have learned something. If you haven't, let us know. And thank you for being here. We'll definitely have to have you back because I want to go into all kinds of questions about diabetes.
I'll be back.
But thank you all.
Thank you.
If you have any questions for Amy or comments, leave those on the chat below or comment. I don't know. You all are on the screen. I'm not. And also, please like and subscribe to this podcast. We love seeing that we have people following us and asking questions and sharing. So it really means a lot to us because we know that you're taking more control of your health. And that's really what we want. We want to empower the watcher. Bye.